Welcome to the module Food as Medicine, presented by Superior Health Quality Alliance. This recording was developed for healthcare workers with an interest in learning about how nutrition impacts health and plays a major role in the prevention and management of chronic diseases, including diabetes, heart disease, and kidney disease. The objectives today are to learn what the term food as medicine means, to discuss different program examples that fall under the food as medicine umbrella, and finally discuss some of the research that has been done on these programs. So let's start by discussing why the food as medicine movement is important. Back in 2021, HR 5724, known as the White House Conference on Food, Nutrition, Hunger, and Health Act, was introduced to authorize the conference aimed at addressing issues related to food insecurity, nutrition, and health in the United States. However, the bill was not enacted into law. The findings of the conference include: in the U.S., more than 38 million individuals live in households that face food insecurity, 12.6 million of whom are children, and 5 million of whom are seniors and persons with disabilities or critical illnesses. The burdens of the food insecurity are not distributed equally, as the burdens remain higher for racial and ethnic minority groups, especially in rural areas and in the South and Southeast. Households headed by Black people and Hispanic people face higher rates of food insecurity, with 21.2% and 16.2% respectively, while the national average is 11.1%. And the geographic distribution of food insecurity remains a serious concern, as rural communities represent 87% of the counties in the United States and the highest rates of overall food insecurity. Nutrition insecurity and diet-related chronic diseases disproportionately affect racial and ethnic minority groups and low-income, rural, and other underserved populations in the United States. And in just 10 years, type 2 diabetes rates have doubled for African American children and increased 50% for both Native American and Hispanic children ages 10 to 19. Conservative cost estimates show the true cost of hunger and illness related to hunger and food nutrition insecurity in the United States is at least $160 trillion per year. With respect to direct medical costs, most of which is paid by Medicare and Medicaid, an amount that exceeds the annual budget of the Department of Agriculture. Food as medicine interventions consist of healthy foods that are tailored to meet specific needs of individuals living with or at risk for serious health conditions affected by diet. Food as medicine refers to a spectrum of services and health interventions that recognize and respond to the critical link between nutrition and chronic illness. Although food as medicine interventions often target food insecure populations, they are distinct from the broader hunger safety net because of their focus on nutrition for chronic disease prevention, management, and treatment. A growing number of healthcare payers, like public and private health insurers, providers like physicians, nurses, and dietitians, and health systems like hospitals and community health centers, are now exploring how they can integrate food as medicine interventions into patient-centered models of care, especially for individuals living with or at risk for complex chronic illnesses. Improving access to nutrition safety net programs such as the Supplemental Nutrition Assistance Program, SNAP, and the Special Supplemental Nutrition Program for Women, Infants, and Children, WIC, can help combat food insecurity. However, for individuals coping with or at risk for chronic health conditions, these programs may not go far enough in preventing or treating illness. By addressing the nutritional needs within the context of healthcare, food as medicine interventions play an important role in preventing and or managing many of the chronic conditions that drive healthcare costs, such as diabetes, cardiovascular disease, kidney disease, certain cancers, HIV, and more. Today we will discuss two types of food as medicine programs: food prescription programs and medically tailored meals. First, we will talk about a very common model, the food prescription or produce prescription model. This is the Washtenaw County, Michigan Prescription for Health, or PFH program, which we will be using as an example of a successful long-term food as medicine program. One of the biggest barriers to maintaining a food as medicine program is finding long-term funding. This program was piloted in 2008 with grant funds and is currently funded by Trinity Health. Washtenaw County's Prescription for Health programs connects patients to their local farmers markets through their medical clinics. Healthcare providers refer their patients to the Prescription for Health program by writing prescriptions in the form of a referral for their patients to eat more fruits and vegetables. Upon enrollment in the program, the participant gets tokens in their enrollment packet and is able to spend those on fruits and vegetables at their local farmers market. Participants then take their prescription to the farmers market to fill 10 times. Participants receive $10 in tokens at each market visit for a total value of $100. Participants also receive nutrition education, recipes, and social support from community health workers at the market, as well as over the phone. If you are interested in starting a similar program, check out the Program Implementation Guide and Program Readiness Checklist developed by the Washtenaw Prescription for Health program. You can also find their outcome reports for each year since 2008 on their website. Sharing outcomes with leadership can be helpful when making the case to start a new program. Here's one more example of a produce prescription program from Michigan. A pharmacy at Grace Health is dispensing a different prescription to patients who have been diagnosed with diabetes, heart disease, hypertension, and obesity. The prescription is for fresh food. Since March 2021, the healthcare provider's Fresh Food Pharmacy, in partnership with the South Michigan Food Bank, has been providing these patients with boxes containing meat or poultry, eggs, dairy products, fresh fruits, and vegetables. They come with recipes tailored to the ingredients in the food boxes. Over the course of 9 months, the boxes are picked up by patients at the food bank or delivered to them by volunteers every 2 weeks. The U.S. Field Scan was created by Wholesome Wave, which is a great resource to learn more about the history and different types of produce prescription programs across the U.S. As you can see, in December 2020, the Field Scan found 32 programs in the Northeast, 30 in the Midwest, 9 in the Southeast, 9 in the Plains, and 28 in the Pacific West. They are also a great resource to learn more about starting your own program. Next, we will discuss another program type that falls under the Food as Medicine umbrella. It's called Medically Tailored Meals. Medically tailored meals are delivered to individuals living with severe illness through a referral from a medical professional or healthcare plan. Meal plans are tailored to the medical needs of the recipient by a registered dietitian nutritionist and are designed to improve health outcomes, lower cost of care, and increase patient satisfaction. In this study from the Commonwealth Care Alliance, They examined whether home delivery of medically tailored meals or non-tailored food would reduce the use of selected healthcare services and medical spending among their members. Because there is a knowingly association between food insecurity and emergency room visits, it was hypothesized that the medically tailored meals would cause a reduction in ER visits and other costly healthcare services and expenditures. The medically tailored meals group, compared to a control group, saw 70% reduction in ER visits and 52% reduction in inpatient admissions. The non-tailored food group, compared to the control group, which saw only 44% reduction in ER visits and only 12% reduction in inpatient admissions. Examining the differences between the medically tailored meal group and the non-medically tailored meal group, the former program was associated with significantly lower medical spending compared to those not receiving any meal support. Average monthly difference was from $570 down to $156 per participant. Now we will dive into a little more research. The Food as Medicine Action Plan, created by the Aspen Institute, is another great resource, including a deep dive into food as medicine research over the last 10 years and provides recommendations for the future of food as medicine. From the report, we identified that over the past decade, research on food as medicine has transformed the field and laid the groundwork for conversations about widespread adoption. The research demonstrates that food as medicine interventions are not only replicable and scalable, but also effective. All three interventions examined in this report have been shown to reduce food insecurity, improve dietary intake, and support mental health. Across multiple studies, medically tailored meals are associated with reductions in healthcare utilization and spending, as well as improvements in disease-specific clinical outcomes. Medically tailored groceries and produce prescriptions have been associated with improvements in blood pressure, hemoglobin A1C, and diabetes self-management, though results vary with intervention design and duration. Now we would like to share a few takeaways and provide resources that may be of interest to you. Here are a few questions to consider to assist you with evaluating your own healthcare settings, needs, and next steps to implementing or exploring options for a food as medicine program. Do you have any programs you currently refer to? If not, what type of programs would fit the best in your practice setting? How would you implement a food as medicine program into their clinical setting? Here are several resources that may be helpful for you to learn more about food as medicine. If you have questions about this video or others, please contact us at info@superiorhealthqa.org. Thank you.